and it's still all about keeping the numbers down as states reopen gradually. Dr. Agatha Wapmuk is a public health physician, and she joins us here in Lagos. Glad you could join us.
Thank you for having me.
All right, first I'd like to get your thought on, our stance on using the rapid test diagnostic test kits. You heard the doctor in the UK who says that it's the right thing, but there's also the fear, or more like apprehension, as to we're not testing as much as we should comparing with our population.
Okay. So in as much as we want to ramp up testing capacity to increase early identification, isolation, and treatment, and also to track contacts of those cases, that is our desire, but we need to do it well, in the right way. We would, the rejection of those test kits by the federal government means that those test kits did not pass the validation tests and the reliability tests. Those tests should be able to give us true positives and true negatives. So we need tests that will give us accurate results, because there are implications for giving false results. If we miss positive tests, we're going to have increased community transmission, and it would imply that we have increased mortality and morbidity and mortality due to COVID-19.
Let's perhaps also talk about what the Lagos State Commissioner for Health said, that isolation beds are under threat, and the projection is if we continue to get over 200 to 300 cases every day, that in 2 to 3 weeks we really might be out of beds, and so the home-based care comes in. But the question really is, are we seeing this projection as a result of the poor state of our health capacity, or more like it's really COVID-19, the disease outbreak, that's causing this?
Okay, I would say both ways. Knowing that Lagos is the epicenter of the infection in Nigeria, we have over 5,000 cases in Lagos, and there is competition for health resources in terms of human and material resources. A lot is being diverted for COVID-19 treatment because of the high number of cases, its high rate of infectivity, associated mortality and morbidity. So with increasing numbers of cases, right now over 11,000 in the country and over 5,000 in Lagos State, there is a tendency that we're going to run out of bed spaces, and it would affect the management of other endemic diseases that are supposed to also benefit from those resources.
But in terms of managing the cases, are you optimistic that home-based care can effectively curb the spread? Because we're also witnessing the silent spreaders in communities.
Yeah. The success of this home-based care depends on a lot of behavioral change by those concerned. There needs to be more education, community engagement, and the community needs to take responsibility for for this treatment to succeed. They need to abide by self-isolation guidelines. And in order to do this, we need to put a monitoring system in place that will ensure that those on home treatment or self-isolation will abide by isolation guidelines, so we don't have increased spread. Because if they don't abide by self-isolation guidelines, we're going to have more community transmission and invariably increase morbidity and mortality due to COVID-19.
What's your take on some persons who are still disputing their results, people who still fear COVID-19, and there are still some people today who feel that such a thing doesn't exist?
Yes, a lot of people don't feel that COVID-19 exists, because that's why we have poor compliance to the public health measures that have been put in place, like regular hand washing, use of face masks. I was in the bank yesterday and I realized that a lot of people in the bank were not using the face masks. They believe that the figures are being cooked up by the government.
And they allowed them into the bank?
Yes, I had to bring the attention of the manager yesterday. There are a lot of people not using masks, so they don't believe it. They believe that figures are being cooked up by the government, and they said they have not seen people that are infected. They've not seen anybody die of COVID-19. They said the pictures of the isolation centers are usually showed to them are usually empty. They don't have beds, so therefore they are not properly informed. So this is where risk communication and community engagement plays a huge role. There has to be sustained risk communication to the communities, sustained community engagement, use of opinion opinion leaders in the community to get to these people. Different forms of communication should be used, both the mass media, print media, social media, and then you use community leaders like religious leaders, traditional leaders, the heads of mechanics, the year lodgers. They need to be engaged regularly. There has to be a sustained risk communication and community engagement to ensure that they believe and know that this is what we are up against.
All right, and know indeed ways that they can protect themselves.
Yes, definitely.
Thank you so much, Dr. Agatha Wapberg, a public health physician. Thank you for joining us on the program.
Thank you.